Hello, I am Josley, a communicator in urological health as well as male wellness and maturity. Many here on the channel know me as Dr. Josley since I have spent years calmly and openly explaining topics that are seldom discussed in consultations. The reality regarding size, circulation, and those habits that can either support or undermine your intimate health. Today, we are going to explore a subject that sparks a great deal of curiosity. Bicarbonate, that white powder you keep in the kitchen, the one your grandmother used for countless purposes. Now it shows up in viral videos claiming miracles for your size and potency. And I hope that by the time this video ends, when you come across the phrase use bicarbonate this way and see what happens to your size, you can smile calmly because you will know precisely what is factual, what is merely a myth, and how to use it responsibly to care for your body rather than harm it. For years, the notion has persisted that there exists some perfect trick, an ideal cocktail, a secret homemade recipe able to alter your size as though the body were moldable clay. People speak of baths, massages, mixtures involving lemon, vinegar, baking soda, as if the intimate tissue were simply a balloon that could inflate further. But the human body does not function like that. Size is governed by genetics, hormones, and development in early life, not by whatever you apply at age 50 or the powder you ingest at 60. What can truly change, and change significantly, is how that tissue fills with blood, the quality of your erections, your confidence, and your overall vitality. And this is precisely where habits, including certain uses of baking soda, can have an indirect influence, though never in the overstated manner that has been presented to you. I want to begin by stating something with full honesty. There is no solid evidence that baking soda by itself permanently increases size. There is no baking soda cream, no baking soda bath, nor any miraculous drink containing baking soda that alters the structure of your intimate tissue. What does exist is a risky combination of marketing, desperation, and misinformation that preys on your insecurity. Why does this story resonate so strongly? Because size continues to be a subject heavy with shame, comparison, and silence. Many men think they fall below average when, in reality, they are well within the normal range. And when someone comes along offering greater size with an extremely inexpensive ingredient like baking soda, the urge to believe becomes overwhelming. My purpose today is to help you take back control, not to offer you yet another gimmick. Before we discuss how to use it, I need you to grasp what baking soda actually is. Baking soda is a familiar salt in cooking that possesses alkaline properties. It is employed in baking because it releases gas and causes dough to rise. In the body, its traditional medical application is as an antacid in particular cases, to neutralize excess stomach acidity. It has also been utilized in hospital settings to correct very specific blood pH imbalances, always under medical supervision. In the realm of sports, it has been researched as a buffer to help counteract some of the acidity generated by intense exercise. In short, bicarbonate is anything but a magical powder. It is a precise chemical agent with defined applications, possible benefits, and evident risks when misused. Now, what connection does this have to your intimate health and size? Here is where it gets interesting. Male intimate response relies mainly on your blood circulation, nerve function, and hormonal balance. Anything that enhances the health of your blood vessels, your blood pressure, your metabolism, and your underlying inflammation can support firmer erections and better expansion of what you already possess. It does not grow, but it performs more effectively. And anything that damages that circulation, such as excessive salt, uncontrolled hypertension, a sedentary lifestyle, obesity, and smoking, diminishes that filling ability. As for bicarbonate, when used carelessly or in excess, it can add a significant amount of sodium, impact your blood pressure, and strain your kidneys and heart. In other words, if mishandled, it can work against exactly what you seek: healthy circulation and robust, intimate vitality. I want you to picture a 65-year-old man, let's name him Ernesto. He sees a video promising that if he takes bicarbonate on an empty stomach for a month, his size will grow and his performance will return to what it was at 20. He does not seek proper information. He does not ask questions. He just follows the recipe, a heaping tablespoon in water each morning. After several weeks, he begins to feel digestive unease, bloating, occasional nausea. Yet he persists because he thinks it is part of the transformation. Eventually, he notices something more worrying. He feels increasingly bloated. His blood pressure climbs slightly, and his sleep worsens. His intimate function, far from improving, grows more inconsistent. What occurred? He did not alter his size, but he did disrupt his internal equilibrium. More sodium, greater stress on the cardiovascular system, increased overall discomfort. His body is trying to tell him something, yet he keeps pursuing an outcome that science has never supported. In contrast, let me tell you about another man. Let's call him Luis, age 58. He also learns about bicarbonate, but he chooses to use it sensibly, not as a gimmick for size, but within a broader approach to self-care. He occasionally uses it in cooking to lessen the acidity of certain foods, stays within sensible limits, and most importantly, recognizes that his real solution lies in improving his circulation, walking every day, controlling his weight, cutting back on ultra-processed foods, managing stress, and fostering confidence with his partner. Lewis might occasionally prepare a warm bath with a small pinch of baking soda to soothe minor skin irritations in the genital region or groin. Without applying it directly to the penis, without vigorous rubbing, and without expecting any change in size. He employs baking soda as a mild skin aid, not as an instrument for reshaping the body. And that is how the substance returns to its proper role: a helper, not the star. Now, let us examine the most common applications of baking soda linked to the intimate area and what they can or cannot offer. One popular practice is sitz baths using warm water with a modest amount of baking soda to ease superficial irritations, chafing, or mild discomfort on the outer skin. For some men with heavy sweating or sensitive skin, this can assist in neutralizing odors and reducing itchiness. It is crucial to note something here. These baths affect the skin only, not the deeper tissues or internal blood vessels. They do not alter structures, nor do they enlarge anything. What they can achieve is greater comfort. And when you feel more comfortable, cleaner, and fresher, your confidence rises. And as confidence increases, your perception of your own size and performance shifts as well. Another important aspect is oral use of baking soda. This is where particular caution is required. Yes, small, carefully measured amounts taken sporadically can alleviate occasional gastric acidity, but making it a daily habit or ritual for enhancing size is an error. Each teaspoon adds sodium. In an older man who often already tends toward hypertension, edema, or kidney issues, this can push things in the wrong direction. Higher pressure, greater vascular rigidity, increased risk to intimate circulation, precisely the opposite of what is needed for strong, healthy erections. Treating baking soda as though it were a male tonic entirely misrepresents its function in the body. Now I want us to approach the subject of size from a different, more realistic, and more freeing perspective. When a man expresses a desire to increase his size, often what he truly seeks is to feel more secure, more capable, more assured in his intimate response. What he wants is not additional centimeters, but a better experience. Fewer disappointments, less anxiety, greater consistency. And here is something vital. If your circulation is working well, your blood pressure is reasonably managed, your blood sugar levels are stable, and your nervous system is not overburdened by stress, your intimate tissue fills more effectively with blood and remains firm longer. What role does baking soda play in this? More than you might imagine, but not because it enlarges anything. Rather because its misuse can undermine the circulatory health you rely on so heavily. Think of your body as a finely tuned system striving for balance. The pH of your blood, for instance, is kept within a very tight range. The body has advanced mechanisms for this: lungs, kidneys, internal buffers. When someone claims that alkalizing your body with baking soda will resolve all your issues, including intimate potency, they are drastically oversimplifying a highly complex matter. You do not need to correct your blood pH with spoonfuls of powder. What you primarily need is better sleep, more movement, eating with reduced salt and sugar, quitting smoking, adequate hydration, stress management, and, if needed, medication adjustments under professional guidance. Those are the genuine practices that support your functional size, the capacity for what you already have to perform at its fullest potential. Now, how to employ baking soda responsibly without making it a hidden threat to your circulation. First, treat it with respect. It is not candy. It is not a harmless supplement. It is a chemical agent with actual effects. If using it as an antacid, do so only occasionally and according to the product guidelines, not inventing large doses found online. If you have hypertension, kidney disease, heart failure, or take certain medications, always consult a professional before oral use. If applying it to the skin, use moderate dilutions in water, avoid direct contact with the most sensitive areas, and never rub harshly. Consider soothing baths, not enlargement treatments. And if you experience irritation, ongoing redness, or discomfort, discontinue immediately. Now, I want to share the story of Martin, a 62-year-old man who visited my consultation and allowed me to anonymously relate his experience. He arrived utterly convinced that his issue was size-related. He had tried it all: exercises, massages, homemade mixtures with baking soda, lemon, and other ingredients that had only irritated his skin. When I asked what troubled him most, he did not mention centimeters. He spoke of fear of failure, of his partner's look, of a recent occasion when he could not maintain a stable erection and felt trapped in shame. Upon examination, we discovered high blood pressure, a sedentary routine, poor sleep quality, and very high stress. His size was not the issue. His circulatory system and mental state needed support. We abandoned the baking soda recipes entirely and focused on daily walking, adjusting blood pressure medication, enhancing rest, and creating space for open communication with his partner. Months later, his size remained unchanged, but his erections were considerably firmer. And most importantly, his confidence had transformed completely. That is the message I wish to leave you with regarding what truly happens with your size. What can genuinely occur if you use baking soda wisely and concentrate on overall health is that your self-view shifts. You stop seeking miracles in the kitchen cupboard and begin creating real outcomes in your arteries, your heart, and your mind. You may keep using baking soda in cooking as a household cleaner or even in mild skin baths, but you will no longer regard it as a magical shortcut, simply another tool in a proper care routine. There is one more element I do not want to overlook: trust with your partner. Many men begin noticing normal age-related changes, erections that take longer, slower recovery, less spontaneous responses, and instead of discussing it, they withdraw, search for fast online fixes, expose themselves to risky advice, and try practices that not only fail to help but can harm the skin, disrupt local flora, or irritate the intimate zone. Indiscriminate use of bicarbonate can dry the skin, upset its balance, and heighten unpleasant sensitivity. Picture this. You are trying to boost performance and wind up with discomfort from the mere touch of underwear. That is not the path forward. Sometimes the strongest step for your intimate health is to say to your partner, "I'm noticing some changes. I want to take better care of myself. I'd like us to discuss it together." It is also worth noting that vitality in maturity depends not on one single product, but on a harmony of factors. Your blood circulation thrives with a diet abundant in vegetables, fruits, healthy fats, quality proteins, and low in ultra-processed items. Your hormonal balance is better maintained with sufficient sleep, stress control, and limited alcohol. Your nerves and intimate response strengthen through ongoing curiosity, affection, playfulness, and emotional connection. Baking soda cannot substitute for any of this. No powder can. But when you take charge of your well-being, all these elements begin to align. And what you see in the mirror is no longer merely size. It is presence, confidence, calm. At this stage, you may be asking whether it is worth using baking soda at all or if you should eliminate it from your life. My response is straightforward. It is worth using with respect for its actual purposes and without loading it with unrealistic expectations. Keep it in your kitchen. Use it now and then to ease mild acidity if your health permits, or for gentle skin baths when there is minor surface irritation. But do not place it at the center of your plan for better intimate health. For that, you have far superior allies. Walk 30 minutes daily, monitor your blood pressure, check your glucose, maintain a healthy weight, stop smoking, stay hydrated, and, if needed, consult a healthcare professional for proper tests and evidence-based guidance. I want to end this session with you on a clear and direct note. Your true size is not found in bicarbonate. It lies in your circulation, your habits, and most of all, in your confidence. It is never too late to reclaim vitality and maturity, to bolster your intimate response, and to feel more fulfilled in your body. But the way forward does not involve miraculous shortcuts. It calls for conscious, consistent, and respectful choices toward your body. If today you choose to set aside empty promises and begin caring for your health at its roots, you have already taken a huge step, one far greater than any centimeter touted in a video. If this message prompted reflection, if it dispelled some myths while sparking genuine hope, I encourage you to examine your own habits, to notice what you do daily for your circulation and intimate well-being. Share this content with a friend caught in miracle recipes or feeling insecure about their size. Sometimes a calm and honest explanation is the greatest gift. And if you wish to keep learning, exploring further, and caring for your intimate health with reliable information, I invite you to subscribe and join me in future sessions. Here we will continue discussing with respect and without taboos what truly sustains your vitality and maturity.